Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
Today in Neighborhood Health Watch, we're talking about genetic screening for miscarriages. It's called pre-implantation genetic screening. The goal is to reduce the risk of miscarriages, which are very common according to doctors. Roughly 20% of women under the age of 35 will have some risk of miscarriage, even if they don't have problems getting pregnant. The risk increases with age. Dr. Anish Shah with the Richmond Center for Fertility and Henrico Doctors Hospital is here to explain genetic screening. Thanks a lot for joining us on First at 4. First, what's the medical definition of miscarriage and why does it even happen?
Well, the medical definition is pretty simple. It's 2 pregnancy losses if they happen consecutively. And if you have, let's say, a pregnancy, a loss, unfortunately, from that pregnancy, then you have a normal pregnancy that goes to term, but in total you have maybe 4 pregnancies and 3 of them are losses. We still consider that a recurrent pregnancy loss.
And why does it happen to women?
The majority of circumstances, unfortunately, is when a genetic abnormality is not compatible with life. It's Mother Nature allowing something that's not going to be healthy stop.
Pre-implantation genetic screening, how does that reduce the risk or help to reduce the risk?
Well, if a woman has infertility and is undergoing IVF, for example, we're able to now look at some of the cells of the embryo and tell them, actually, is this going to be a miscarriage or it's going to be a healthy pregnancy? And it's pretty groundbreaking research and development in our area of medicine, because for the first time in roughly 5 years, we've been able to boost our pregnancy rates with, at the same time, reducing the number of pregnancy embryos that we put back.
That is awesome and also groundbreaking. Does that mean after the screening, in some instances, like the woman will have to make certain decisions?
No, actually, in this case, the embryo itself, if we have, let's say, 3 embryos from in vitro fertilization, we'll know that these, normally we would just put 2 back, hope that one was a healthy pregnancy, and sometimes we'll see another one continue, but then the heartbeat would stop.
All right, and very quickly, who's a candidate for this type screening?
This is usually anybody who's undergoing any kind of fertility treatment.
All right. Dr. Shah, thank you so much for joining us.
No
We
problem.
appreciate it.
Thank you.